Good sexual and reproductive health is a state of complete physical, mental, and social well being in all matters relating to the reproductive system. Access to a clear advice, and information on sexual health is crucial, as is being able to choose from a range of contraceptive options without facing any stigma or discrimination. Despite clear reasons for necessity of sexual health awareness among people, it is contested issue and has faced challenges and in most of the cultures. At Medicircle, we are conducting an exclusive interview series on the occasion of Sexual Health and Awareness Day, showcasing eminent sexologists and sexual health educators over a discussion to bring awareness about sexual and reproductive health issues, its treatments, and myths related to it. I'm Smita Kumar, and in this series, today our guest for the talk is Dr. Dwibhashi Karteek. Dr. Karteek is an experienced sexologist, psychosexologist, and infertility specialist, currently practicing at Sri Venkateshwara Empire Clinic, Andhra Pradesh. He is the member of Council of Sex Education and Parenthood and also a professional member of International Forensic Sciences. He is also a hypnotherapist and an occupational health specialist. Hello, Dr. Karteek. Welcome to Medicircle.
Hello, nice to meet you.
So to begin with, Dr. Karteek, kindly brief what should one do to maintain and improve sexual and reproductive health?
Yeah, this is the most important question. So first of all, I would like to thank you for giving this opportunity to speak in Medicircle. And so presently, there are many aspects in dealing with this question. So first of all, I deal with the following components. First one is sexual exercises. Second is masturbation. Third is workouts. Fourth is diet. And fifth one is manage anxiety and stress. Sixth is open communication. Seventh is sexual pleasure drives in an environment of passion and excitement.
Okay.
So when you go to the sexual exercises, because nobody knows, because there are a lot of exercises, but there are also sexual exercises which are very important for both males and females. Okay. So first one is try the stop and start technique. So this technique is usually used for males. So it is very simple. Just breathe deeply and start again the same process, so that you every time you feel an ejaculation and you have to stop the ejaculation immediately. Then once again you must release. So this in this pattern, it will solve the problem of erectile dysfunction, which is almost the 70% contributed to the problem in the worldwide. So the second thing is masturbation. In masturbation, males there is also in males and in females. So masturbation is also important thing, but there is also some of the things, because masturbation, even though it is important, weekly twice is sufficient for the age group of 20 to 32 years. If it is more than two sessions, then automatically it will lead to a condition called hypersexual activity disorder, HSAD, or hyposexual activity disorder. So I have been facing all these problems with most patients, because they don't know the actual time for the utilization of masturbation, because they are doing more rather than prescribed by the sexual counsel. So next thing is workouts. So workouts, almost everybody know workouts. It's a different type of workouts. I will just explain in brief. That is, first one is there are 4 sets of 20 knee to elbow crunches would have to be done each and every day. And after that, they must do 20 leg raises, which is also 4 sets. Next, there's 2 minutes elbow planks, 2 minutes elbow planks, 2 minutes hollow hold, and there must be 4 sets of 10 Superman stretches. So everybody knows about Superman stretch. So it is actually used. And when you come to the females, there is plank for 20 seconds, glute bridges for 15 repetitions, and jump squats for 10 to 15 repetitions, and Kegels with 5 to 10 second holds. Because Kegel exercise is most important, because they control the pelvic muscle strengthening. In almost 3 interval sets before pregnancy, during the pregnancy, and after pregnancy also, Kegel exercise plays a huge and important role. And next comes to the push-ups for 10 to 15 patients. Pigeon pose, holding for 1 minute on each side.
Okay.
So these are the workouts.
Definitely.
When we come to the another exercise, that is exercise to steady your breath and strengthen your tongue.
Okay.
So most of people don't know all those things. So I'm explaining this, the tongue pull back and tongue push-ups. So each and every time you must hold the tongue position for at least, you must bring back the tongue and place it in your mouth as far as you can. Hold this position for 2 seconds, repeat for 5 times. And another thing is tongue push-ups. Push the bottom of the tip of your tongue as hard as possible so that it must be in the front of the roof of your mouth, right behind your teeth. Repeat for 5 to 10 times. So this is most important. And next we come to the diet. So diet plays around 25% in the treatment of most of the diseases also.
Okay.
In the diet, I will explain you. The most important is capsaicin. Capsaicin is found in most hot peppers, so it will increase and boost your endurance. Capsaicin-rich foods include chili peppers, sweet peppers, ginger root. Another is potassium.
Okay.
So there are electrolytes in three components, that is sodium, potassium, and chlorides. When you come to the potassium, potassium is one of the more important electrolyte because it keeps your muscles and cells hydrated, aids in recovery, and boosts your metabolism. So it will also increase your stamina. So potassium-rich foods include banana, spinach, broccoli, white potato, tomatoes, carrot, low-fat milk or yogurt, and quinoa. And another thing is carbohydrates, because there are two types of carbohydrates. One is simple carbs and another is complex carbs.
Okay.
Most people think eating pasta and bread will increase your stamina, but it is completely wrong, because there are simple carbs found in pasta and bread. So it will kill your stamina. For that, you must require complex carbs. Complex carb foods include oatmeal, which we usually suggest to our patients. Another is yams and sweet potatoes, whole wheat bread, brown rice and wild rice, peas and dry beans, and quinoa also, if it is available. Next comes to the proteins. Proteins take longer than carbs to break down, giving your body a longer lasting source of energy. So foods packed with protein include nuts, tofu, eggs, lean red meat, poultry and fish, yogurt, cheese, and milk. Next, we come to B vitamins. B1, especially that is B1 to B5 and B12, regulate your sex hormones levels and functions. So it will increase your libido and performance a boost. So foods rich in B vitamins include lean meat, fish, and poultry, eggs, peanut butter, avocado, fortified and enriched grains, milk and dairy products, leafy and green vegetables. Omega 3s. So omega 3s are called as essential fatty acids.
Yes.
They help to balance your sex hormones. It will also increase your libido and stamina. Foods packed with omega 3s, because lot of the controversial thing about omegas. So I just explain you in brief. That is, they are available in flax seeds, chia seeds, and hemp.
Okay.
Chia seeds is also rich in selenium, and there is kale and spinach, walnuts, mussels, and tuna and other oily fish. When you come specifically for females, the most important thing is L-citrulline, which is the most important amino acid that increase the strength and the stamina. So foods rich in L-citrulline is watermelon, onions and garlic, legumes and nuts, salmon and red meat, dark chocolate. L-arginine is another form. The body converts L-citrulline to L-arginine. This is another amino acid that improves the blood flow and builds protein. Foods with L-arginine include red meat, fish, and poultry, soya, whole grains, beans, milk, yogurt, and other dairy products. Next, we come to nitrates. So the most important thing is the nitrates improve your muscles. They use your oxygen, which help enhance your performance inside and outside the bedroom. So nitrate-rich foods include arugula, Swiss chard, because all these arugula, Swiss chard, these comes under microgreens, which it is better to use it as per the agriculture of Agriculture Council of America. They have described the balanced diet in which microgreens plays a key important role. And another thing is beets and beet juice, and carrots, eggplant, and celery. When it comes to magnesium, magnesium is an essential nutrient that plays a key role everything from energy to brain function. So when your magnesium levels are low, your stamina is depleted. So foods high in magnesium include whole wheat, spinach, and other dark green leaf vegetables, quinoa, almonds, cashews, and peanuts, black beans, and edamame. Specifically for females, that is the most important is folic acid. So folic acid
Yes.
stimulates development and growth of new cells, which fights against fatigue and boosts stamina. Foods
Okay.
packed with folic acid include avocado, lentils, dried beans, broccoli, citrus fruits. And another thing is calcium. Calcium is important for the bones, everybody knows that.
Yes.
So in calcium rich foods, that is skim milk, cheese, low fat yogurt, salmon, and other edible fish. Next, we come to vitamin D. So vitamin D, it is mostly important because in corona also we're using vitamin D drops. So vitamin D supports the bone, it increases the immunity and bone health also, lifts your mood, and it is also important to make, it will maintain your healthy weight. Healthy weight is important because most of the people, due to loss of healthy weight, they gain obesity, which is the most important problem leading to diabetes mellitus. So the great sources of vitamin D include salmon and sardines and egg yolk, shrimp, fortified milk, cereal, yogurt, and orange juice. Next, we come to iron. Iron-rich foods include red meat, poultry, fish, fortified cereals, kale, spinach, and other leafy greens, lentils, and beans. So these are the foods. When you come to the herbs, so there are also some types of herbs, but this is a controversial topic regarding herbs because there limited uses of herbs is required. If you there is increased dose of herbs, then it will lead to poison.
Okay.
So before using these things, you must note the specific dosage of that. So for everyone that is demonia, is a subtropical band. It will increase the sexual desire. Another is guarana. This is a Brazilian plant. Another thing is meca. So specifically for males, ginseng is important. So it will almost treat the symptoms and it will improve the erectile dysfunction in males. Another thing is ketuba. Ketuba is also in is it an aphrodisiac and it is found in the it is a native of Brazil. It will also help to treat erectile dysfunction. Next comes to lycium. Lycium is goji berry. So lycium is a Chinese fruit plant which is used to increase the testosterone levels. There is no need of using testosterone tablets prescribed by some of the sexologists. So it is not required. It will treat the erectile dysfunction also. When you specifically come to females, that is ginkgo biloba. This is also a Chinese plant
Yes.
extract is required to gain the sex drive, and it also improve your brain power and energy. And I think it's ashwagandha because it is everybody knows this drug ashwagandha. It is available in almost everywhere. So it is also an evergreen shrub. It is used to improve your libido and stamina by regulating the sex hormones.
Okay.
When you can, the another concept is another thing is manage anxiety and stress because anxiety and stress is found in almost every individual, and it you can see you can measure the stress values by doing the test of cortisol, which mentions what are the ranges and what are the levels of your stress which are dealing with daily. So there's anxiety and stress make it hard to get or maintain erection,
Okay.
both for males or females. There is the same thing is there. And so how to manage the anxiety and stress? Because as per psychology there is different concepts, but as per psychosexology we are having different concepts. Almost they are similar, but there are slight differences there. One is that focusing more on physical sensation than sexual performance, exercising, which I have explained earlier, getting more sleep, because minimum we must require 8 hours of sleep, because in most of the people they are not utilizing the sleep, that is that 8 hours duration. Actually the 24 hours period has to be distributed into three parts: 8 hours for work, 8 hours for dealing with your family life and exercise, 8 hours for sleep. So when they are deprived of sleep, there are a lot of disturbance, that is hormonal disturbance is going on in our body. And another thing is working to improve relations, meditating, spending more time on a favorite hobby, going to therapy.
Okay.
Next, we come to open communication. Open communication is most important because when the newly married couple is there, first of all, there is no development of any fantasy bond in the mean. After some time, there is development of fantasy bond because there is some hiding or concealment of some of the issues between both of the couple. So leading to a problem that is you are having difficulty in sexual exercises, sexual experiences, there is lack of sexual experiences. So all these things are there. So open communication is the best thing to do it. If there is failure in open communication, then there are other procedures as per the psychosexology. You can do that procedures also. I will explain it further. So first of all, what we have to do is, if there are issues related to sex, it can create tension and worry. It is best to bring this up with a partner. You must write down what are the problems which you are having. So this is called cognitive behavioral therapy, CBT. In CBT, what we require is we ask the patient, both of the couple, in to write down what are the liking things which they like, what are the dislike ones. So likes and dislikes are seen in both of the thing, and they must exchange their both papers. After exchanging both papers, they will understand that what are the dislikes which he is suffering and what are the dislikes which she is suffering. Then only there will be development of physical and psychological, which is emotional bond will be developed, and the fantasy bond, which is the main culprit for the destruction of a marital life, will be uh, removed. So that's the thing which we do it. And then when it comes to the sexual pleasure thrives in an environment of passion and excitement, which is the last one. In this, if a person has been seen with one partner for a long time, sex can begin to feel routine. So this is the most thing which is usually seen in our patients. It may seem increasingly difficult to feel excited, remain focused, or please the partner. But so what is the thing? So somebody thinks, no, no, it is better to use multiple partners. So that's not thing which we are explaining. So how to deal? Because marital life is sacred. So to protect the sacred marital life, there is another way which you can do it. That is cooking together, going to a museum, seeing a brand new sport, or trying a new sport, whatever it may be. But spend some time with your partner, either to go to the movie or some other place. Then only there will be development which is more emotionally bonded will be there. Otherwise, there are a lot of problems will be seen.
Definitely.
So these are things which I need to explain. I hope you have explained all the topics.
Definitely. I think my audience would be definitely having a good advice, especially on sexual exercises and also the diet. So, coming on to the next one, Dr. Dwibhashi, in India, sexual and reproductive health is considered as a bad topic, and mostly the youth is introduced to the puberty from other sources and not from their parents. So, do you think this is the reason people find it difficult to discuss sex related matters with their parents? And how can one eradicate this communication gap?
Yes, definitely. First of all, what we must know that there are sources for anxiety of parents and sources for anxiety of teens. So, what are the sources? I will just explain brief. So, first, I will explain the sources for anxiety for parents. Simultaneously, I'll also explain this source for anxiety for teen also, so it will be relevant. First one is real or perceived ignorance, because they don't know what are the things and what they will ask. First, not knowing the answers, not knowing the correct language to use, and sounding crude, being wrong or corrected, having different answers than other parent or adult. In in case of teens, that is real or perceived ignorance, not knowing the correct language to use or sounding crude, not knowing the right questions to ask, being wrong or corrected. There is another problem, that is saying too much, because what the child asks, they must say that thing appropriately, but they say too much. That's the problem which many people face. So saying too much, providing more information than your child is ready for, revealing too much personal information, revealing family secrets, disclosure of abuse of self or another. In case of children also, there's revealing sexual thoughts or behavior to the parent that might elicit criticism or punishment, disclosure of abuse of self or another. There, there is some phobia or fear of difficulty in questions, that is, parents, it is about how babies are made. In case of children, questions about current sexual behavior. So in case of parents also will explain other things, that is about contraception, fertility, abortion, pregnancy, and so forth. About parents' own adolescent behavior or adult sexuality, about prior relationships, separation, divorce are there, about abuse experiences, about sexuality spectrum. And in case of teens, you can see that questions about abuse, questions about the sexuality spectrum, finding out something unknown about the child. He is already sexually active, uses contraception or had an abortion. Because there is a chance of teen pregnancy, which is usually seen in US. The same thing is going to happen in India also, which is reporting in some places. So that's what I'm explaining. Then another thing is, has experienced abuse or vulnerability to abuse. Is it a LGBTQI and has been exposed to pornography, has sexted or sent explicit language photos via social media, because some people are using social media for all these things. And when coming to the teenage, what the teens expect is about their current or past sexual life, a negative family secret or disclosure of abuse. So this is another thing which they want to know about their parents. Fear of teens' reaction or perception. That sounding stupid, sounding old-fashioned or out of touch. Teen will not be open to the conversation or topic. Disclosure of abuse. And you come to parents' reaction. This is the same thing. Parent will not be open the conversation or topic, asking something that shocks, offends, or angers the patient. And asking something the parent refuses to answer. Disclosure of abuse. There are some topics which feel discomfort to the parents and some feel discomfort to the teens. So that is, it will create an embarrassment, shame, and fear. These are the similarity between both of them. So now what I'm going to explain is what are the probable questions and what the kids want to know from their parents. This is the most important thing. So I'm just explaining. According to the age, so when you come to the age range, that is 7 to 10 years, that's the adolescence. What the kids want to know is words for their genitals, breast, body parts, functions, bathroom humor. Questions to expect. That is physical development, how they compare to others. Some girls will become puberty or menstruation at this age and should be prepared by their parents. Example, what is the period? When will you start? When do you start? When will my breast go? These are the questions they usually ask. Then another thing is the age of 11 to 12 years, that is early adolescence. Words for sex, body parts and functions. May use sexual words even though they may not know the precise meaning. Bathroom humor and sexual humor may have seen pornography. So when you come to the sex education in school, it must start at fifth or sixth grade, but usually it is seen at the 10th grade. It's for eye wash. So they don't know all those things. So parents should allow their children to participate and continue in the conversation at home. Questions may focus on the mechanics of sex and pregnancy. What is masturbation? What is oral sex? What is anal sex? Sexuality spectrum. That is what is gay. How does someone know that they are gay? So these are things, and there are other things, few things also. That is online and second. And how do gay people have sex? How does girl become pregnant? What is an erection? What is nocturnal emissions? When you come to the age of 13 to 14 years, that is early mid-adolescence, basic understanding of most of the sexual behaviors, growing sexual vocabulary, may have been masturbation. Some teens will become engaging in sexual behaviors with partners, example, kissing and touching. Some teens will experience love. Most girls will begin menstruation, and most boys will experience actions. Teens will have the questions related to sex and pregnancy. How old should I be when I have sex for the first time? How old were you when you had the sex for the first time? So these are the questions usually asked. How do I decide when do you have sex with someone? What is an orgasm? Can women's organism? Can I become pregnant for the first time when I have sex? What do condoms feel like? So when you come to that age of 15 to 16 years, most have begun masturbation, understanding consequences to sexual behavior such as pregnancy and infection or disease, sexual behaviors with partners, some intercourse, difficulty discerning love and lust. So what they expect is that approximately 15% of the teens begin having sex by the age of 15. More questions will focus on the risk of the various activities of pregnancy and or STIs and prevention. Can I get an STI from kissing, oral sex, or NSS? How can I tell that I have an STI? That's sexually transmitted infection. How can you tell if someone has an STI? What is HIV/AIDS? How effective are condoms, birth control pills? What is emergency contraception, and how do I need, and how and where you get the condoms? At the age of 17 to 18 years, that is late adolescence, there is difficulty discerning love and lust. Most teens have engaged in at least one sexual behavior with a partner. About 50% of teens begin having sex between the age of 17 to 18 years and likely experience intense physical and emotional attractions to their partners or potential partners. So the questions may rise around the romantic love. How do you know if you are in love? Were you in love for the first time you had sex? So these are the things usually we expect from the kids. And so the most important things about the sexuality, there is many parents focus on providing factual and mechanical information about sex and neglect discussions of emotions, sexual pleasure and values. There is likely a fear that portraying sex in a too positive, that is positive light, may entice and encourage experimentation. So this is the most important thing which most parents think. Parents may need help understanding that conversations about sexuality can be factual and sex positive while simultaneously communicating boundaries and values. These are important. Just not discussing about all those things doesn't prove that it doesn't isolate the kids from doing these types of activities. So you must tell them the moral science and moral values, ethics, which they have to maintain. These conversations are opportune times for the parents to relate their values and expectations in relation to their child's behavior. For example, if you have sex, we believe it is important to use a condom for your health and safety. Condoms help prevent STIs and unintended pregnancy. When appropriate, parents may want to share decisions that they may have regretted in their own teen years, discuss how they might have handled the situations differently. So these are the important things. And the most important things is about the vaccination. So most of the parents don't know about the vaccination according to sexology. So I will tell the vaccination thing. The Centers for the Disease Control and Prevention, CDC, states that the children ages between the 11 and 12 should be vaccinated against HPV, that is human papillomavirus, which provides the tip sheets for talking to the parents about the HPV vaccine. HPV, that's human papillomavirus, causes cancer. So about the cancer of the genitalia, there is cervical cancer, vulval cancer, vaginal cancer in females, and penile cancers in males. So it is better to take vaccination, which have to be given at the age of 11 and 12 years. So HPV can be transmitted through a variety of intimate activities involving contact with genital mucous membranes or body fluids, even if an infected person has no signs and symptoms. So early vaccination is recommended,
Okay.
and this is one of the things.
Okay.
So
So, Dr.
another thing is the
Yes,
last,
yes, you were saying something.
yeah, yeah, the last but not least, that is sexual orientation. There must be a discussion of the parent-child communication about sexual orientation, which is important to resolve the issue.
Okay.
So those are the things.
So, Dr. Dwibhashi, one quick one on the STDs, like sexually transmitted diseases, continue to be one of the significant public health concerns. While awareness is a possible solution, what other factors do you believe which shall help reduce the spread of STDs?
Yes, one thing I want to mention is that STDs, according to United States, every year they estimated of 20 million new STD infections. So nobody knows all those things. So I'm just explaining. 20 millions every year, the new and new are going to come, and it's going to develop in the United States. The same thing may be in India also, because we don't have any particular data about these STDs according to India. And so anyone who is sexually active can get an STD. So sexually active is seen in some of the groups. that is adolescent and young adults, gay, bisexual, and other men who have sex with men, pregnant women and infants, racial and ethnic minorities. So when you come to the first one, how can you prevent this from getting this STD? So there are some things which we can explain it in short. That is practical absence. The surest way to avoid STD is not to have sex. This means not having vaginal, oral, or anal sex. Use condoms, which is repeated by most of our colleagues in the medical practice. So that is another thing. Having fewer partners. So as per your Indian culture, only one partner is preferred, and it is also good. So another thing is get vaccinated. Just now I have explained in the previous question, that is regarding the HPV. All boys and girls ages 11 to 12 years, but the vaccine can start at age 9. Everyone, though age 26 years, if not vaccinated, can be vaccinated. So these are the things. And there must be testing of STDs, which is also important. So I'll go to the testing. So all adults and adolescents from the ages 13 to 64 should be tested for HIV at least once. All sexually active women younger than 25 years should be tested for gonorrhea and chlamydia every year. Women 25 years and older with risk factors such as new or multiple sex partners or sex partner who has an STD should also be tested for gonorrhea and chlamydia every year. All pregnant women, this is already done in each and every hospital before delivery. That is syphilis, HIV, hepatitis B testing will be there. And all sexually active gay and bisexual men, they should be tested at least 1 year for syphilis, chlamydia, and gonorrhea. Those who have multiple anonymous partners should be tested more frequently for STDs at 3 to 6 months interval. Sexually active gay and bisexual men may benefit from more frequent HIV testing every 3 to 6 months. Anyone who has unsafe sex or shares injection drug equipment should be tested for HIV at least once a year. So these are the guidelines as per the CDC. So I hope everybody would understand this and stop the STDs.
So thank you so much, Dr. Dwibhashi, for sharing this insignificant information about sexual and reproductive health with our viewers today. As a dedicated healthcare media portal, we at Medicircle definitely hope that through these initiatives, we are able to educate and aware people, especially about the sexually transmitted diseases and the factors that can stop the infection. Once again, thanks for joining.
Thank you very much.